fourth chapter, that is hygiene. Okay. Another 10th chapter is sensory needs is there. These are the two important chapters that is allotted me for the as a portions. Okay. And now I am going to do the hygiene chapter. In that, so in this video we will get only the these points, these objectives. Okay, that is introduction part and factors that is affecting the oral hygiene practice, and what are the common mouth infections you will get if you are not practicing the oral hygiene, and what are the oral care that we can provide as a nurse, we can provide for the conscious patients or an unconscious patients. There are two important what you can say, that is skills, that is one is oral care for the normal conscious patient, okay, the patient with the conscious patient, and with the unconscious patient another one. Okay, there are two skills. So we will look after that in a procedural steps one by one later. Okay, so first what is the hygiene, and before that you do this activity, tell me which is the single most effective method to prevent the health care associated infections. Option A, wearing the gloves. Option B, isolation. Option C, antibiotic prophylaxis. Option D, hand hygiene. Which one is the right answer? Hand hygiene, right? So hand hygiene is the correct and the first attempt to make or else to prevent the infections, where every healthcare provider they will do, right? So wearing the gloves is after the hand hygiene. So in the hand hygiene we know that there are two important things, that is medical hand washing and surgical hand washing. In the medical hand washing also we will see the two things, that is only for the medical hand washing itself. Okay, another one is hand rub. So we know that medical hand washing is 40 to 60 seconds and the hand rub is only about the 20 seconds we need to perform. At least we need to perform at 20 seconds for the hand rub with a 70% of isopropylaxic propyl acid, right? So which is the right answer then? The right answer is hand hygiene, right? So okay, so hand hygiene is that much important, then overall the body of the patient hygiene is very important. That may be in a physical appearance or that may be in overall the body cleaning thing. Okay, so we have said that, so hand hygiene is the most effective way to prevent what? The infections. If you want to make a barrier from the bacteria or a virus, so that you need to clean that, first one is hand hygiene. Okay, so if you maintain the hand hygiene in the clinical, so that you can prevent the cross infection among the healthcare providers also, among the patients also, right? Okay, so good hygiene will make the positive self image and also comfort. What does it mean? So positive self image means you are maintaining, you know what about your weakness, what about your strength, and you are being a confident, you will walk or else you will talk, or else whenever if you have a oral bad smell, okay, oral bad smell, can you able to talk confidently? No, right? So if you are having the good hygiene practice like oral care, so and also bathing, okay, if you have these type of practices on a daily basis or according to your cultural practice, then you can maintain yourself as a positive self image, and also you are so much comfort to talk and to communicate or conversation, right? Okay, so we will see what is the introduction part of the hygiene, right? So hygiene is not only particular to the one part, it is related to the skin care also, it is related to the hair washing or hair care also, and the tooth brushing and nail cutting. So these are all also one of the part in the hygiene, right? So cleaning and cutting and washing of these things, and also washing the cloths is also comes under the hygiene, right? So hygiene means it's a practice of maintaining the cleanliness. Okay, it is a practice of maintaining the cleanliness that is conducive to the preservation of the health. If you want to preserve your health or else if you want to promote your health, So then what you should do, you need to maintain the hygiene. So what is the meaning of hygiene? That is practice of maintaining the cleanliness. Clear? Okay. So here, so we need to make the personal care activities, that is the main important foundation in the nursing department, okay, or else we can say the nursing professionals, right. So getting into the that, as I said, it promotes the sense of well-being, or else it will make the positive, what I said, positive self-image, right, positive self-image, right. So we'll get into the first introduction part we completed. Next we will get into the next important thing, that is factors affecting the hygienic practices. What are the hygienic practices that we are looking for, and what are the factors that will make increase in the promoting the health, and also that will affect the health, okay. That means promoting health also, and it will make affect, means you have to think affect means it is positive also, negative also. Whether it is affecting positively, whether it is affecting negatively, that we have to see. Clear? So coming to the socio-cultural background. In the socio-cultural background, we need to see the socio-economic status and also cultural background. Are you understanding? So as I said, I have been already sent the notes, okay, no need to worry. Notes is there, exact the points is there in your notes, okay, you read it from there. Clear? Now you listen. Clear? So socio and cultural, here in the two words is there, socio-cultural. One is socio-economic status is also very important, another one is cultural background also they have to see. First one we will see, that is economic status. So economic status is having directly connection to have the supplies that will provide articles to make the hand hygiene or make the bathing, okay. So some of the supplies are so much costly, or else it will be very medicated soap. Suppose you take medicated soap, or else that may be like a costly one, costly brand, you can't able to afford, means you are not able to maintain your health properly. If you are not maintaining health, your problem means that is due to the hygienic problem, okay. In this factor, what is the main factor? That is economic status is a main factor that will affect the hygiene in terms of money, or in terms of the supplies that you don't have, or else you have. The positive and negative I am telling, no. So affect the factors affecting. If you have more money and you can afford all the things that others rich people they get, okay. So that is this is about the point, okay. Next, cultural point. So the cultural point here, some of the cultural that will awares and that will provides to have a deodorant, or else to take daily baths. In some of the cultural they don't use the deodorants, okay, or else they will say only once in a week you can take the bath, okay. So different cultures will make the practice of hygiene differently, and that will affect positive also, negative also in the health. Clear? Are you listening there in the last? Is that listening? Is my voice is hearing there up to last? Okay. So that is about the socio-cultural background, right? Next one is spiritual practices. Spiritual practices before prayer or before eating, so you should maintain some purification. So in what we can know that in the namaz, before namaz, what they will do? They will do the wuzu. Wuzu means that is also purification. Or else in the before eating, so they will wash their hands. That is also hygiene, right? So purification is one of the religious belief. A religious belief is also one of the factor that will maintain the hygiene, right? So if they maintain the hygiene through the factor called religious belief, so they can promote the health, no? Are you understanding? So next one is some traditional ritual baths. After immediately after the childbirth, or immediately their menses finishes, okay, that time they will do what? Traditional ritual baths in different traditions or different cultures, right? So that will also affect what? That will also affect the health in a positive way if they are practicing. If they are not practicing, in a negative way it will affect. Clear? Okay, next coming to the developmental levels. What is the meaning of what is this factor and how it will affect? See, as the age, now I will start with here age. As the starts, it will starts from 7 years. Okay, suppose 7 years. I am taking example 7 year, 18 year, and also 80 years. In which age you are considering more hygiene practice? That is, in the 7-year-old you will practice more hygiene, right? So then in the 18 there is no need of you are being a parents. If you are being a parents, you no need to teach them a practice, because in the 18 years we can call it as a adolescence age. In that age they will modify new technique or a new modification in their hygienic practice. Why? Because in order to uphill or else in order to make their physical appearance to be different. Okay, so in order to make the unique physical appearance, they will make a different, they will adapt new hygienic practices, right? Are you understanding? So coming to the 80-year-old people, so 80-year-old people, what they will do? Actually they can't able to mobile means they can't able to move. Okay, or else if they wash daily, they will get what? They will get a pain, or else they will get scratches, or they will get due to the dry skin they may get irritation also. So they can't able to take bath daily. Okay, sometimes they may forget also due to the aging problem. Okay, so this will happens in the age. Now what you can say, as the age increases, there is a decrease in the hygienic or bathing frequency. Okay, so you can see here bathing frequency decreases with the age. That means as the age increases, bathing frequency will decreases. Are you understanding? Okay, so next adolescents will become more concerned about their physical appearance, or else they will adopt the new hygienic measures, as I said, right? And next, family practices. All the children in the family, they will follow the elders. Okay, now the elders, if they are good in hygienic practice, then children also will follow. Clear? Coming to the newborn, so that elders has to give interest to make the hygienic practice for the child, or I can say the newborn, right? So I hope you understood the developmental levels. In the old age, there is a decrease in bathing frequency, or else you can say that is hygienic practices. In the adolescents, you can say there is a new adaptation of the hygienic practices measures. Okay, and next one is family practices. As the child will follow every family members their unique style of hygienic practices, and the child will follows that, right? And next one is children learn hygienic practice while growing up, right? So coming to the next factor, that is health state. Now if the illness, if it is there, so that will create the demand for a new adaptation, new modified hygienic care for the healthcare providers. Suppose healthcare providers, so healthcare providers, what else they can do? So now the patient is unconscious or patient can't able to move. What we have to do? So we need to give the care at the bedside. Clear? Are you understanding? So that is a new modification. And some people like with the piles, or you can say hemorrhoids, for them we need to give the sitz bath. Sitz bath means in the bathtub they have to sit with the warm water, not hot water, warm water with a betadine solution. We need to 1 or 2 betadine solution we need to put in the bathtub. Okay, are you understanding? So they need to do the sitz bath in that. Clear? Are you understanding? So that will be it is a different hygienic practice, right? So comparing to the normal being and illness, we are comparing now the health state, that is comparing both healthy also and illness also. Healthy person can take bath daily, whereas illness patient can't able to take bath daily. That is factor. Clear? Okay, one is illness, another one is weakness. Due to the weakness or due to the dizziness, so they can't able to sit or they can't able to stand. So they may get dizziness, they may fall. So in order to prevent falling, so we need to give them tub bath, or else we need to give them bedside shower. Okay, are you understanding? Next one is disease or surgery people also they can't able to ability. Here the person's ability is very low to perform the hygiene, right? Are you understanding? Okay. So last factor, the last second factor is personal preference. Now someone they have tub bath, okay, someone will have the hard what you can say bar soap bath, okay, they have bar soap bath, they have personal preferences. So some people will have liquid soap, so you know about the liquid soap, isn't it? So their preference is different, that will also affect the what, that will also affect what, the health, right? So people have a different preference regarding the hand hygiene practices. Example, as I said, shower from the top, or else from the tub bath, or else from the bar soap, or else from the liquid soap, right? And next, so sexuality influence personal hygiene practice also. Sexuality means what? Now here in the males may have different hygienic practice. Suppose the males will only prefer the soap for all, okay, for all, that means for the hairs, for the body, for the every privacy part, for everything they will use only the one particular soap. Why it is not? Wait. Yes. Okay, sorry for the interruption here. So what we have to see here, so man have different choices, man don't have that much different choices because they will prefer more soaps, isn't it? If they prefer soaps, then for the every, that may be for the hairs, that may be for the body or privacy part, everywhere they may use the soap. But females is different, by they will differently they will use, that means shampoo they will use, or else a different liquid soap for the different parts, so they will use like that. Clear? So that is a sexuality influence preference, they may prefer different brands. Clear? So different brand soaps for different okay. So now older adults, so older adults they will always they will give what, they will have they will give some what we can say, some hints or some points they will give. So you should wash it from this one, or wash it from the neem, something else they will give. So old practice they will be influenced by the old adults, okay. So that is the preference. Are you understanding? This one everyone understood? Okay. So we have completed the introduction part, we have completed the factors affecting part. Now I am sorry, the last self-care abilities is also factors affecting. Suppose if the patient is having poor vision, can he able to notice the stain in the body? He can't able to notice, right? Poor vision will also affect the health, okay. And decreased hearing, someone is telling, suppose the healthcare provider itself telling daily you need to take bath, every 4 hours you need to do the oral care. So if they are telling they can't able to listen, means how they will do, isn't it? And next, decrease the sense of touch. If the person can't able to feel the touch, okay, they can't able to understand what stain or else what insect is on their body, they can't able to sense, right? And next one is limited range of motions, as like I said, for the increased age people, that means more age people they can't able to do. And a decreased coordination, like Parkinson's disease or a coma patients, unconscious patient, they can't able to do the hygienic practice. Decreased muscle tone or muscle strength, they can't able to do with the what we can say, appropriately they can't able to do the practice. Next, impaired balance, even though they can't able to stand properly, how they will do the hygiene. Next, decreased memory, they don't know when they have done the bath, okay. So that time that time also the health will affect due to this hygienic practice. Clear? So self-care care abilities will affect everything, like how they will perceive, what they will think, and whether they will remember or not, whether they will sense the touch or not. So these things also affects the what factors that will affect the health, and also hygienic practices will be changed. Okay. So hereby we have completed up to the factors, right? Next we will jump to the next one, that is sorry, this one is, so this one is, we can say, common mouth infections. Okay. What are the common mouth infections we will see, right? So firstly we will see the plague. So plague means here whatever the invisible or a soft sticky biofilm, that may be a rice, okay, that may be whatever. So if you are not brushing or if you are not gargling, then it will stay between the tooth itself. That time what happens, the invisible layer will form. Okay. So this invisible layer which have the ability to cause the gingivitis also. Gingivitis means the infection and inflammation to this gums. Okay. So that is gingivitis. And here very importantly, this one is very important, painless and also gradual. This is not onset, this is not suddenly it will comes. So daily if you are not doing the oral care in the night, suppose night you have eaten the biryani or else you have eaten something else, and you have not done the gargling or you have not done the oral care, then what happens, there is a biofilm or else the invisible soft item that will stick in the between the tooth. So that will forms a layer which is yellowish color or else something different color as the food it is, right? So that will be that time what happens, the bacteria will comes, right? So it will causes the infection to the gums, that is called gingivitis. Are you understanding? So here very importantly, it will not on single day, suppose today you have not done the oral care, that doesn't mean today only you will get the plague. After a prolonged period of the same practice, you are not caring the oral, that time you will get the plague. Are you understanding? Now after getting the oral plague, dental plague also, you are not caring and you are not showing to the doctors or you are not getting the appointment from the doctor, so that will get hard, okay, and that will get calcified, and that will makes that name called tartar. Okay, what it is? Tartar. Tartar means it is the hardened dental plaque. So whatever the invisible soft is there, no, that one will become hard now. Okay, so that hard cannot be removed by brushing. So the plaque can be removed from the brushing, but this one tartar can't able to remove from the brushing. Okay, so what else we can do then? We can ask the professionally scaling method. Okay, so you have a flossing method, right? So that one also we can do. So that is what we can say, tartar. Tartar means hard. Hardened dental plaque is called tartar. Plaque is a only plaque if they ask, that time you should say invisible soft sticky biofilm adhering to the tooth surface and making the availability of the bacteria to cause the what? Gingivitis, right? Are you understanding? Next, so halitosis. What is the meaning of halitosis? Suppose that whatever you eaten, no, that one will causes the unpleasant mouth odor. So it will causes the bad smell. I said no already that bad smell. So bad smell means in medical term you should say that is bad smell from the mouth. It is called halitosis. Are you understanding? So why it is happened? So because of the poor oral hygiene, because of the periodontal, that means deeper tooth with the gums. Okay, that one. So that cavity infections we call periodontitis or pyorrhea. So I will come to that. So periodontal diseases, from that also you will get what? Halitosis. And xerostomia. Xero means dry. Xero means dry. Stomia means mouth. Dry mouth also will causes the what? halitosis, and dental caries. So in Kannada we call ulkalu, okay. So dental caries. And next one is smoking or tobacco, that one also will cause halitosis, everyone knows. And oral infections like oral candidiasis or oral thrush will also causes the smell. And systemic diseases that will affect overall systems, that may be respiratory, that may be digestive system, every system will be affected, that is called systemic diseases. Clear? Are you understanding? Sometimes systemic inflammatory response disorder or a syndrome will get, so that will also will make the halitosis. Are you understanding? So why I am choosing the first plaque, second tartar, third halitosis, because I need to explain lastly for this one, okay. This one is fourth one, right? I am sorry. So fourth one, here what it is, this one trench mouth or Vincent's infection, or else we can call this one as a acute necrotizing ulcerative gingivitis. I expect this one as a 2-mark question for your exam, because this one is different from all the things, right? So ANUG, what is this? ANUG, ANUG. ANUG means what? Acute necrotizing ulcerative gingivitis. So in this ulcerative gingivitis, what happens actually? Same as like what you have taught in the plaque. So in the plaque, what you have said, there is a gingivitis due to the bacterial infection, right? Here also the same thing, but the gingivitis, not only the redness will be there, redness with the base there is a grey color. I will show here. You can see there is a grey color is there, right? Are you understanding? There is a bump which is coming out, between the tooth with the what we can say, that is a grayish color, okay. Pseudomembrane, okay, grayish pseudomembrane. Are you understanding? Okay. So it will also causes the foul breath, we can call that as a halitosis. And gingival necrosis, so death of the gingival cells, gum cells. So this one is the gum cells that will get death due to the bacterial infection, that is called necrosis. Are you understanding? Necrosis means what? Due to the infection the cells will get die, that is necrosis. Are you understanding? Okay. So next, sir, which organism will cause this ANUG, that is Fusobacterium nucleatum or else treponema species. Like syphilis infection, you will get the treponema species, okay. Are you understanding? So I hope this one, all the 4 mouth infections you understood. Now we'll get into the next other 5 infections, that is glossitis. What is glossitis? Glossitis means that is inflammation of the tongue. Inflammation of the tongue is called glossopharyngeal. You know, gloss means what? Tongue, okay. Are you understanding? Glossitis, inflammation of the tongue. Next, stoma. Stoma means, as I said, that is mouth, okay. Mouth infection, that may be ulcer, that may be tongue ulcer, cheek ulcer, that may be gum ulcer. Whatever the ulcer you take, oral thrush, every ulcer will be considered overall as a mouth ulcer. Glossitis is also mouth ulcer. Pyorrhea is also mouth ulcer. Are you understanding? Mouth ulcer is a, stomatitis is a complex word. Under that sub infections are glossitis, or as gum infection is gingivitis. Here gingivitis is there, right? Are you understanding? So first we will see the glossitis, that is inflammation of the tongue. Stomatitis means inflammation of the mouth, mucous membrane and gums. Clear? Are you understanding? Okay. So pyorrhea or periodontitis. So pyorrhea also we can call, or else we can call periodontitis. Periodontal, that means deeper tissues of the root of the teeth will get infection or inflammation. That one we can call pyorrhea or periodontitis. Are you understanding? Okay. Understood? Okay. So gingivitis means gums. This one, gums. Okay. These gums, if it is infecting, then we can call what? That is gingivitis. Next, dental caries. So dental caries have different story. I will tell you. So this is not because of the only bacteria. Okay, if that is bacteria, then you can call it as what? Plaque. Okay, you can call it as a plaque only whenever there is an invisible surface layer. Are you understanding last? Okay. So, dental caries means here the saliva converts. So, whenever you eat food, suppose rice, it is also one of the carbohydrate. When you eat the carbohydrate, that time saliva will comes different, that may be ptyalin or that may be amylase, that will comes and wants to break down that starch into monosaccharides. Are you understanding? So, when that starch or a complex carbohydrate into simpler form, so that time it will converts into lactic acid as a byproduct. Clear? This lactic acid will dissolves the enamel of the tooth. Okay, whenever there is a dissolving of the enamel of the tooth, so there is a exposing of the inner aspect of the tooth. So that is called dental caries. Are you understanding? Can you see here? So there is a exposing of the what? Inner aspect. Clear? Hello sir. Sir, I am class ಅಲ್ಲಿ ಇದೀನಿ sir. Okay, understood? Yes. So now, we have completed all the things. We will see what are the things that you remember. What is the meaning of plaque? What is the meaning of plaque? Can anyone tell me? It is a invisible, soft, or else sticky biofilm on the tooth, right? Am I right? Yes. Tell me what is tartar? Hardened plaque, right? Hardened plaque will be called as, or calcified plaque will be called as tartar. Halitosis means bad smell from mouth. Next, what is anug? Anug means what? It is also known as trench mouth, right? So what it is? Acute. Acute means suddenly it will come. There is a sudden. Acute means what? Sudden, or else we can say onset. So plaque is a gradual. Plaque is gradual. That means after 2 months or after 3 months it will come. But anug is all of a sudden there is an infection. Suddenly it will causes the painful. It is very painful. But this plaque is not painful. It is painless. It is painless and gradual. This one is anug is painful and also onset, not gradual. All of a sudden it will comes. This is also due to the bacteria. This one is also due to the bacteria. That's it. Clear? And this one is due to the invisible sticky biofilm. This is not due to the sticky. This is ulcerative of the gums, direct to the gums. Okay. Next, dental caries. As I said, that is dental caries is a dissolving of what? Dissolving of enamel. Dissolving of enamel by what? By the lactic acid. By the lactic acid. Are you understanding? Are you understanding the points? Okay. Gingivitis means gum infection. Next, periodontitis means deeper tissues of the root of the deeper tissues of the gums, of the root of the what? Root of what? Root of the tooth. Okay. Next, stomatitis means mouth infection. Glossitis means what? Infection and inflammation of the tongue. I hope everyone understood this one. Okay. If they ask 2 more questions, you have to write this one. Clear? Okay. Next. So, oral care. So, we will do the oral care. Only this page we will do, and next one we will see in the next class. Okay. So, only these things you now we have seen the common mouth infections, and after that we are looking for the oral hygiene. That means in what way I am telling, in what way I am teaching. First I said about the what is the disadvantage if you are not doing the oral care. Now I am showing what is the actual procedures of the oral care. So if you do this, then you will not get that common mouth infections. Are you understanding? Are you understanding? Okay. So, we will see oral care. In this oral care, so mouth and teeth of the patient is very importantly we need to clean, that is oral care, right. So, to create the sense of well-being, he has to think, that is I am good in smell of the mouth, or else he has to feel that I can eat, okay, I can edible of whatever the food I can give, or else fruits, vegetables I can masticate it properly. That is we can say they create the sense of well-being. Clear? Next one, so enable the patient to have a clean mouth and aid good digestion. If they masticate properly, then only it will be correctly complex form is converted into simplest form, right. Next, teach the patient to develop a good habits of oral hygiene. Okay. So, here we will see self-care abilities, already we have done in that. Clear? So, importance of the oral hygiene we will see. So, it is a mouth is an ideal place, it is a very good media, okay. It is very good media, okay. It is very good media for the bacteria, for the multiplication of the germs, and to get a very good place for the warm also, for the cold also it will get, for the warm also it will get nice area to grow the bacteria, okay. And there is a availability of every time there is a food is available. Clear? So, that is why we need to, in order to prevent the infection, we need to do the oral hygiene, that is the importance. Clear? Next, a clean mouth gives a good appearance. Am I right or not? Okay. So, you can see the celebrities mouth, it will be shining. Why it is shining? So, because they are giving care more to the oral. So, that is clean mouth will gives the good physical appearance, right, and prevents the bad odor. So, that is why they can easily talk with the, confidently they can talk with the whoever it is, right. So, improves the appetite and digestion. So, they will get good hunger also, and they will get good digestion also, right. Next, so in order to get the comfortable of the patient, when the patient will get comfortable, when he is having oral hygiene correctly or oral hygiene. So, that will be like gives comfort to the patient, right. Prevent the sores and ulcers, and brown crust like plaque or tartar will be prevented, okay. And another thing is cracks of the lips. See, oral care is not only teeth, tongue, not only that, lips is also care. So, what they will do? They will apply water based gel, okay, water based gel, not oil based or petroleum based. They will apply water based gel to prevent the crackles of the lips. Are you understanding? Okay. So, next one is patient have many diseases from the bacteria that will be eliminated by the oral care. Are you understanding this one? Okay. Importance also finished. Last one, that is elevate the head of the bed when you are giving the care. Elevate the head of the bed 30 to 45. If the patient is able to sit, then you can give the Fowler's position itself, that is 90 degree, 60 to 90 degree you can give. Next one, and whenever after the applying water, then you have to suction it. So, which one you will give? That is Yankur suction. Yankur suction we will call. Yankur suction, by suctioning the whatever the content after the washing. Okay. After washing there you have to suction it, no. So, that is Yankur suction, keep it, remember. This one is very important, Yankur suction. Most commonly used to remove the drains or remove the whatever the washed water based in the mouth, okay. And using the normal saline for washing, okay. And sometimes you can use the hydrogen peroxide, but not all the time. So, you need to avoid the routine activity of the hydrogen peroxide. You can use the hydrogen peroxide, not all the time. Clear? Next, brush the teeth if it is conscious twice a daily. If he was unconscious, 4 hours in every day, 4 hourly you need to give, okay, oral care. That does not mean every time you need to brush, no. Gargling and just drinking the water is also oral care. Are you understanding? Okay. Next, assess the lips for the crackles, assess the gums for the infection, assess the teeth for the caries, assess the tongue for the infection, assess the oral mucosa for the any ulcerations, okay. And next, soft bristle tooth, and you should teeth you need to brush like this. Okay, you need to brush like this. Okay, from the gum edge to tooth edge. Okay, from the gum edge to tooth edge, you need to what you need to do, you need to brush, right? So next one, assess the lips, we have finished. No, next one is maintain oral moisture, prevent the dryness, avoid the lemon glycerol swabs. So you need to apply some swabs to clean. Okay, so that you should not clean with the lemon glycerol, because lemon is so much irritating. So that will irritate the mucosa, and that will create the very prone to get oral ulcerations. Are you understanding? So hereby we have completed the important things, that is the definition of hygiene. Don't think I have not said the definition. See here, definition is there. Hygiene is the practice of maintaining the cleanliness in order to conducive. Conducive means that must happening to preserve the health. Are you understanding? Are you understanding? Okay. So this is the definition of the health, and this is the introduction of the health. Next, introduction of the oral hygiene and factors affecting the hygiene practice, oral hygiene practice. When we came to the particular hygiene, means we have came to the particular hygiene from here. Okay. So here we have started with the oral, not all the body. Are you understanding? We have started only the oral. Still hair is there, still nails is there. Okay. Are you understanding? So we have started what? Only the oral. In this part we have started oral. In the next part we will see how the oral conscious and unconscious, the steps are there, we will see. Okay. So hereby we are ending the session today. Thank you for watching the class.